Hello everyone, welcome back to our channel. This is Guntur Medical College, Department of Anatomy. In this video, we will see the gross anatomy of the lungs. And in this video, first we will see the right lung. So what I am holding is the lung. How to identify the side of the lung? That is the first question if you are given the lung specimen in the first MEBS practical exam. Otherwise, hold it in the anatomical position. So first you have to identify the side, right or left, then you have to hold it where it is in your body. That is the meaning of keeping it in anatomical position. If you see the lung, you should not tell that it has 2 lobes or 3 lobes. That is the way to identify. You should not tell, that is not the correct answer. How you have to identify the side of the lung is, so this conical part, apex should be kept up above, and this sharp anterior border should be present in the front. So that is the way to identify the lung. You don't tell the lung has 2 lobes, 3 lobes. You have to tell keeping the apex in above, and this is the base below, and the sharp anterior border in front, so that it is now the right lung. So that is the way to keep it in the anatomical position. Okay, so that is the first question you will have. Now you have to identify the features of the lung, right lung. This is apex. When you are asked to show the apex, you have to show like this. The part above the impression of the first strip is called as apex. Don't show it like this. This is not the apex. The part of the lung above the impression of the first strip. That means if you think this is the first strip, this is my finger. So the part above this is entirely is apex, which is not in the thoracic cage. It is in the root of the right side, root of the neck on the right side. So it will be covered by the cervical pleura and by the substance fascia. So this part of the lung is not in the thorax. That you students should understand. Apex of the lung is present in the root of the neck. So the next surface, what we are seeing here as a whole, this, can you see all the impressions of the ribs? So what is this surface? Simple. You should tell costal surface. As a whole, this is costal surface. These are the impressions of the ribs on the costal surface. So that is the surface. One surface we have seen. Another surface which we are having entirely will be called as the medial surface. So we have 2 surfaces for the lung. One is this is the costal surface, and this is the medial surface. If you see in the medial surface, it is again divided into 2 parts. This part is related to the vertebral bodies of the thoracic vertebra. So this surface is called as the vertebral surface, and this part is related to the mediastinum on the right side. So this is called as mediastinal surface. So now I am clear, I think. Medial surface is again divided into vertebral part, and this is the mediastinal surface. So now what I am holding in here, this is the base. This base of the lung is concave, and it is related to the dome of the diaphragm below. So this is the base of the right lung. Borders, if you see, so as we have told in the beginning itself, this is the sharp anterior border, and this is the blunt posterior border. 2 borders. Now we will see the impressions on the mediastinal surface of the right lung. Whenever you are telling about any mediastinal surface, you have to speak clearly. In the center is the hilum of the lung. So students should understand the difference between the hilum of the lung and root of the lung. The usual question in the practical exams. This hilum of the lung is this non-pleural impression on the mediastinal surface of the lung, that will be called as hilum. Root of the lung is a part of mediastinal pleura is extending to the hilum, holding all these structures. So that will be called as the root of the lung. So if you see the contents in both the hilum of the lung and the root of the lung, all will be the same, because they are if you think this is the mediastinal pleura, which is now reaching the hilum of the lung, the contents will be the same in both hilum of the lung and the root of the lung. But difference is, hilum is an impression in the mediastinal surface, and root of the lung is the part of the mediastinal pleura. So this is the hilum of the lung, right lung. So here you will be asked, you will tell so many bronchus, arteries, you will be telling in the exam. You may be asked how you will identify the bronchus or arteries. If you palpate here, bronchus will have the cartilaginous walls. So that should be called as the bronchus. So this is the right lung. So it has pulmonary artery. Both lungs will have the pulmonary artery right and left. So in this right side, above the pulmonary artery, one bronchus will be there. So this is that one bronchus. And below the pulmonary artery, another bronchus. Then students should think, what are these two bronchi? Usually the trachea divides into right and left bronchi like this. So this is one right and this is one left. So these will be called as the right principal bronchus and left principal bronchus. So this right principal bronchus is above the pulmonary artery. So that is called as EPARTERIAL bronchus. Then what is this? Another bronchus on the right side. So this is primary bronchus or principal bronchus, which will give rise to secondary or lobar bronchi. On the right side, the lobar bronchus to the upper lobe is given outside the hilum, so which is now passing below the pulmonary artery. So this is the hyparterial. So below the artery it is hyparterial and this is eparterial. So eparterial bronchus is formed by the right principal bronchus and this is formed, hyparterial is formed by the upper lobar bronchus. Then we have the pulmonary artery, pulmonary veins, all the other contents you read in the textbooks. You should tell in any order from above downwards, from medial to lateral correctly. So that is the mediastinal surface. In the center we have the hilum of the lung. Above this is the right side. So this is the impression for the arch of azygos vein. So this is the, you are seeing arch of azygos vein. And this is the cardiac impression. So hilum of the lung, above the hilum of the lung, arch of azygos vein. In front of the hilum of the lung, this is the cardiac impression. So this is right side formed by the right atrium. So this is the cardiac impression formed by the right atrium. Now we will see the behind the lung, behind this hilum of the lung. If you see the behind the hilum of the lung, this part, a part of this is damage and removal of the lung. So here behind the hilum of this right lung, it is related. So in this part, it is related to the esophagus, and on the left side will be related to the descending aorta. If you see in the above the arch of azygos vein, this part is related to the trachea. So this is right atrium. So what vein will open here? So this is the superior vena cava impression. This is right atrium. So superior vena cava, inferior vena cava impression, tracheal impression, arch of azygos vein, hilum of the lung, and here we have the esophagus. And two nerves are related to this surface. In front of the hilum of the lung, right phrenic nerve. In behind the hilum of the right lung, we have the right vagus nerve. So in this, lung may be kept in the practical exam. The mediastinal surface of lungs may be asked as essays or short notes. Even the bronchopulmonary segments may be asked as short notes or essays. I hope you should have understood this right lung. We will see in the next video what is the difference between the mediastinal surface of right lung and left lung. All the other are same. Only you have to know the difference between the mediastinal surface of the right lung and left lung. Okay, thank you.